Well, colon cancer isn't an easy topic to talk about, but it is important to talk about it and be well informed. And joining us now is Dr. Petar Vuskasin from Dignity Health Glendale Memorial Hospital. Good morning, doctor. Thanks so much for waking up early with us on a Saturday morning.
Good morning. Thanks for inviting me.
Stats show that more than 200,000 people will be diagnosed with colon cancer each year. So what are the signs and the symptoms?
Yes, it's actually the third most common cancer that we have in the United States. But the good news is it's also the most preventable cancer that we have. 1 in 20 of us will get colon cancer in our lifetime in the United States. But with prevention and with understanding the disease and the signs, we can cut that by up to 80 to 90% as an individual. The signs of colon cancer, unfortunately, for early colon cancer, the most common sign is no sign whatsoever. There are no symptoms. The signs and the symptoms we talk about associated with colon cancer, which are change in bowel habits, bleeding with bowel movements, mucus, bloating, cramping, weight loss, fatigue, those are all associated with more advanced disease. So we really don't want to wait until the symptoms occur. We want to catch the disease before it ggets there. And even better, we want to prevent the disease from ever happening. And
when you say prevent, is that something our doctors do, or is that something that we need to be doing?
Well, I think it's both. The prevention comes through screening. Screening is looking for a disease before we have any signs. There are several screening methods, the most common and most effective of which is colonoscopy. But you, as an individual, also need to be aware that these are available, and you need to bring up with your doctor that you're interested in colon cancer screening.
Okay. Now, recently, I have to say, I saw a commercial where you actually send in a sample and a test is run?
Yeah, there's more and more things like that. Colonoscopy remains the gold standard. It is the most effective way, and not only in finding cancers, but also finding the precancerous lesions which can be removed and stop the cancer from happening. There are a variety of tests, including looking for blood in the stool, and even now in the days of genes and genetics today, we can actually look for cells within the stool that may indicate there's cancer there. But they just indicate whether there's a problem, which then would lead to a more specific diagnostic tool, which is a colonoscopy.
And we should be doing that once we hit 50, or?
For routine cancer screening, everybody should have a colonoscopy at age 50.
Okay.
And then about every 10 years afterwards, unless risk factors develop.
Okay. And if you are unfortunately diagnosed, what are some of the treatments that you all have now?
Now, there's a wide variety of treatments. We practice what's called a coordinated care effort to treat cancers. There depends on where the diagnosis is, which part of the colon. It also depends on what stage or how advanced the cancer is. But the treatments would include surgery, chemotherapy, radiation, and a lot of supportive treatment from other professionals, dietitians and physical therapists and support groups, those kinds of things. So it really is a joint effort to work with the patient to get rid of this disease.
Okay, and before we let you go, if you've had a family member, maybe your mother or father had colon cancer, should you try to get your colonoscopy sooner than 50?
Absolutely. Now, like I said, 1 in 20 people in the United States get colon cancer. So most people have more than 20 patients in their family or people in their family. So it's not unlikely you'll have somebody in your family with colon cancer. We're looking for people who have multiple members and people who have members who have colon cancer at a young age in their family. In those cases, you want to talk to your doctor because we want to start screening a bit earlier and do it more frequently.
Okay, Dr. Vuskasin, thank you so much for joining us this morning. And for more on Dignity Health Glendale Memorial Hospital, just go to our website, KCAL9.com, and click Seen on TV.